Thank you for joining us for this next session, Physical Activity and Exercise for Women with Ovarian Cancer. I'd like to thank our sponsor, Alkermes, for making this session possible. We know that exercise can improve quality of life for cancer patients. Today, Dr. Heather Leach is joining us to talk about evidence-based approaches to exercise that can help you feel your best. Dr. Leach is an associate professor and is director of the Physical Activity for Treatment and Prevention Lab in Health and Exercise Science at Colorado State University. Read her full bio here on the conference platform. Thank you for joining us, Dr. Leach, and I'll turn it over to you.
Hi, everyone. Thank you for joining me today in this conversation about physical activity and exercise for women with ovarian cancer. My name is Heather, and I'm a professor in the Department of Health and Exercise Science at Colorado State University. And I've spent the majority of my adult life learning and teaching about the effects of exercise to prevent chronic disease and the benefits of exercise for people living with chronic disease. Over the last 8 years or so, my research program has focused on how to help cancer survivors become more active and study the benefits of the effects of different physical activity programs and interventions on a variety of health outcomes among cancer survivors. So in the first part of the talk today, I'm going to summarize the current research evidence for physical activity and exercise specific for women with ovarian cancer. And in the second part of the talk, I'll discuss the results of our current program called Fit Cancer, specific, again, to our participants with ovarian cancer. Okay, so what does the current research tell us about physical activity and exercise for women with ovarian cancer? So to date, the majority of our research evidence comes from studies among survivors predominantly of breast, colon, and prostate cancer. From these studies, we have about 2 decades of pretty consistent evidence that has shown us higher levels of physical activity are linked to better quality of life and fewer treatment concerns like fatigue, depression, anxiety, decrements in physical function. And B, that higher physical activity levels do show an association with improved disease-free survival from those 3 types of cancer. Studies that have examined the relationships between physical activity and health outcomes and the effects of exercise interventions exclusively in ovarian cancer survivors are relatively more recent. So I'm going to spend some time reviewing these specific studies, and I'll start with some of the observational studies and then move into the intervention studies that we have. So in terms of physical activity and health outcomes, several observational studies have shown that for women with ovarian cancer, higher levels of post-diagnosis physical activity are related to better quality of life and less fatigue. For example, one study found that women who maintained or increased their physical activity after their ovarian cancer diagnosis had better quality of life scores compared to women who decreased activity or remained inactive. And another study, for example, showed that ovarian cancer survivors who were meeting the CDC physical activity guidelines reported significantly lower levels of fatigue than those not meeting the guidelines. When it comes to some of those longer term outcomes like survival rates, the majority of observational studies have demonstrated that high levels of physical activity both before and after diagnosis may be related to reduced cancer-specific mortality. However, a more recent study that just came out in May found that among a pretty large sample of women with ovarian cancer, so about 1,500 women were in this study, their post-diagnosis activity levels were more strongly associated with better cancer prognosis. So specifically, this study found that there was no association between ovarian cancer-specific mortality and the physical activity done before diagnosis, but they found that women who reported higher levels of activity, so about an hour and a half of moderate intensity activity per week, something like brisk walking, in those 1 to 4 years after their diagnosis, had approximately a 33% lower risk of ovarian cancer mortality compared with the women who reported less than 30 minutes of activity per week. This study also found a significantly increased risk of death among women who decreased their activity from pre to post diagnosis. So often after presenting, some observational data like this, these associations between physical activity levels and health outcomes or survival rates, the next question is often, well, if physical activity is so good for women with ovarian cancer, they must all be doing it. Thus far, some of the studies that have looked at the levels of physical activity have found that from both longitudinal, so studies that have followed women over time, or cross-sectional studies, suggest that women tend to decrease or have lower physical activity levels post-diagnosis compared to before their diagnosis. Further, physical activity levels tend to remain low beyond the period of active cancer treatment, and the majority of women with ovarian cancer are not quite achieving CDC physical activity recommendations. So although I've shown you some pretty good and consistent support for the benefits of physical activity for women with ovarian cancer, that evidence was largely, again, from observational or cross-sectional studies. So often the next step is to then test these associations using experimental design, such as an exercise intervention. So these studies ideally would randomly assign participants to an intervention, which would help them increase their activity level, or to a no exercise control group. And so far in the literature, there have been 5 studies that have evaluated the effects of an exercise intervention among women with ovarian cancer. In general, the findings were pretty consistent with the observational studies. Those who received the exercise intervention saw improvements in quality of life, physical function, reduced fatigue, and several of these interventions helped women increase their physical activity levels post-diagnosis. So to summarize, research has shown that physical activity is beneficial for women with ovarian cancer, especially physical activity done after diagnosis. Some women may have a difficult time getting started or returning to activity post-diagnosis, and exercise interventions seem to help, but they may also be hard to access, potentially like we saw during COVID, or for those who don't live near a major cancer center or academic medical institution and have access to these types of interventions. And I'm just going to pause here for a moment so that any of you, if you want to take a photo of this slide, you can have a look at some of the references that I was speaking about when reviewing some of that literature. So I'll just give you guys a moment here to either write them down really quickly if you'd like to go and read some more about those specific studies. Okay, so this brings me now to the second section, or the next section of our talk today, where I'm going to introduce the program that we run out of my lab designed to help cancer survivors increase activity levels and hopefully achieve the benefits of exercise. And I'm going to show you some very preliminary unpublished data from the ovarian cancer survivors who participated in this program over the last 6 months. So we started the Fitness Therapy for Cancer program, or FIT Cancer for short, at Colorado State University in 2017. And it started as the basis for one of my graduate students' thesis projects. So after running the program for about a year, we just received such excellent feedback that we were providing such a great service to the local cancer survivor community that in 2019, we decided to implement Fit Cancer as sort of an official outreach program in the Department of Health and Exercise Science. So we've been running it since then. The basics of the program is that it's an 8-week-long program. It consists of weekly, so once a week group-based exercise classes, and we do 3 behavior change discussion sessions to help foster increases in physical activity. So participants would come to our lab at CSU and complete individual assessments before and after the program, so different physical assessments to measure strength and fitness, as well as some questionnaires. So they come to the lab, do their assessments before and after the program, and then they would complete the exercise sessions either at CSU or a local community fitness center, depending on space and what we had available in a given semester. So the primary goal of Fit Cancer is to help survivors gain the knowledge, confidence, and skills to exercise independently, while also engaging in a supportive group environment. So the active ingredients of the program, if you will. So one of them is supervision and instruction from a qualified exercise professional. And this, in my lab, is often graduate level students who have a 4-year degree in kinesiology or health and exercise science. And then they come to my lab to receive further training in exercise oncology. Our second sort of active ingredient, again, in addition to supervision and instruction, is the use of theoretically based behavior change strategies. And we do this really to encourage long-term physical activity. We want people, again, to have the knowledge, confidence, and skills that they can exercise safely and independently after the program ends. And finally, so our last active ingredient, based on the literature and some of our own studies as well, the other thing that we think is really important in an exercise program for cancer survivors is contact and support with other survivors during the program. So you can see these quotes here represent findings from a previous study, and in general are suggesting that exercising with others who have had a similar experience has been shown to be really motivating for people. It improves adherence to the program. There's more of a sense of accountability. And subsequently, one of the things that we found in our lab, that this idea of enhanced adherence, more enjoyment, also might contribute to further improvements in quality of life. So again, this is sort of our third active ingredient in the Fit Cancer program. So we had been, chugging along since 2017, and then delivering the program face-to-face in Fort Collins, and then 2020 happened, and just like everybody else in the world, once the COVID pandemic hit, our program was faced with the challenge of, do we just shut down indefinitely, or do we find a way to modify the program to accommodate all of the public health safety guidelines that are being put in place? And we're not sure how they're going to change, how they're going to evolve, how long these things are going to be in place for us. So fortunately for me, since I work with some really talented and motivated students, we really didn't want to just throw our hands up and shut down and wait. We got antsy after a couple weeks. So we began asking ourselves, how can we deliver all of our active ingredients of Fit Cancer in a virtual setting? Can we create the same team environment that is so important to us? How can we replicate our guided behavior change discussion sessions? And how can we continue providing supervised exercise sessions with a qualified professional? So in my very biased opinion, I thought these were excellent research questions. So I wrote up a proposal in the hopes of receiving funding from the University of Colorado Cancer Center to help us determine whether it was, first of all, feasible to do Fit Cancer 100% virtually, and whether we would see similar effects. So fortunately, I received the funding to sort of help jumpstart us to do this project. And then fast forward all the way to January of 2021, and we were ready to go. We were ready to launch the virtual Fit Cancer program, which we called the Virtual Innovation Pilot, or Fit Cancer VIP. So the structure of the program remained the same. So we did individualized pre and post assessments, 8 weeks of classes once per week, and all of the program components were delivered in real time via Zoom. So nothing was recorded ahead of time. We did everything live. And participants were sent equipment and any program materials in the mail before the program started. So here's what one of our exercise sessions would look like. We always had 2 instructors present. So one, as you can see down on the very far, so my right, probably it should be the same for you. Lydia there at the bottom is demonstrating and leading the exercise session. And then one of our other graduate students, Matt, there in the headphones, he's checking any vital signs that we might have on people, and most importantly, watching exercise form. So if somebody was doing something that maybe wasn't the right mechanics for a certain exercise, we could wait till the break, and that could pull them into a breakout room and remind them that, hey, just make sure to have your shoulder back when you're doing this type of exercise. So we'd always have 2 instructors present at the sessions. All of our exercises were modified as needed within each group based on each individual's medical history, treatment status, and fitness level. So all participants got the same equipment, and sessions sort of had the same general layout, the same amount of time, same number of exercises, the same general type of exercises, an upper body, a lower body, a cardio. But each exercise could be adapted. So for example, if someone, let's say, had a bad shoulder, we would instruct that person. So rather than doing, let's say, an overhead shoulder press, we might have them do a bicep curl or an upright row. So they were still doing an upper body strengthening exercise, but we would modify it according to their needs. Similarly, if someone was feeling, extra fatigued on a certain day, we might instruct them to take longer breaks between each circuit session, or maybe do some exercises in a seated position. And then our behavior change discussion sessions would take place right after exercise. So then the whole group would just stay on the Zoom call to chat. And everyone would stay in the same group with the same people for the duration of the program with the same instructors. All right. So, let's get going. Let's dive right into some results. So as I mentioned, we launched Fit Cancer VIP, or the virtual version of Fit Cancer, in January of 2021. And we had 41 people enroll, representing 12 states and 1 Canadian province. And of those 41 people enrolled, 22 were women with ovarian cancer. So for the remainder of the results, I'm only going to talk about those 22 women with ovarian cancer. So we'll keep the results specific to them. All right, so most of our referrals were, the vast majority, as you can see in the pie chart here, were from support groups. Then we had a few from OCRA and Inspire websites, and then it looks like about 1 there from a friend or family referral. Our ovarian participants ranged in age from 48 to 75 years young. We had a large range of diagnosis stage, with 82% diagnosed with stage 3 and 4 ovarian cancer, and then 18% with stage 1 and 2. All of our ovarian participants underwent chemotherapy and surgery as part of their treatment. And then, as you can see here, some had radiation therapy as part of their treatment. The majority of our ovarian participants had completed treatment, but 40% were still receiving chemotherapy at the time they started the program. So we're going to get into some nitty-gritty of data. So let me orient you to this graph, because you're going to see the same type of graph over the next few slides. So for all, and these are going to be for all of our outcomes of the program. So the thick horizontal line is showing the average change from pre to post program. And those vertical bars there are just showing, what the variability, or how much variability there is in the data. On the y-axis, or the vertical axis on the left, so that's always going to change depending on the unit of measurement of each outcome. So this first outcome here is our assessment of upper body muscular strength. So again, before the program started and the week after it ended, we asked participants to complete as many bicep curls as they could in 30 seconds with a 5-pound resistance band. So they did this single arm, so we did it for each arm, and then we averaged the 2 arms together. And we just counted the number of repetitions there that were done in 30 seconds. And as I mentioned before, all of these assessments were done over Zoom in real time, individually with one of the Fit Cancer program staff. So here for bicep curls, from pre to post program, we saw a statistically significant increase in the number of repetitions completed. So on average, it was about 5.5 repetitions from pre to post program increase. So our next outcome, we looked at lower body muscular strength. And for this, we used a sit to stand measure. So the number of times that somebody could completely stand up and then sit back down in a chair in 30 seconds. So same thing as the bicep curl. We did this before the program and after in real time with observation from a staff member. And for this one, we also saw a statistically significant increase. And in this case, the average was about 2 repetitions increase from pre to post program. So this outcome is the minutes per week of strength training that participants reported at the pre and post program assessment. We saw a pretty large increase. So overall, an increase of 34 minutes per week of strength training. And this outcome also reached statistical significance. Our next outcome, and this is the minutes per week of moderate and vigorous aerobic exercise. Again, that participants reported at their pre and their post program assessment. So in this particular outcome, you can see from those vertical lines, we had a lot of variability in this data. So even though we actually saw a pretty large increase, so on average 73 minutes per week, we saw an increase in moderate and vigorous aerobic exercise, but this particular outcome did not reach statistical significance. But again, very preliminary data, so we'll continue to, as we build our sample size and to study this some more as well. In terms of well-being, so we used a 5-item measure from the World Health Organization, and we saw on average an increase of 2.7 points on this particular scale. But again, we had some large variability, and this change did not reach statistical significance. So as much as I love data, often some of our most powerful indicators of program success actually come from our participants. So at the end of the program, all of our participants complete an evaluation survey. And these questions, so the answers are rated on a scale of 1 as low as definitely no, all the way up to a 7 as definitely yes. So it sort of ranges from definitely no, possibly no, I'm not sure, possibly yes, definitely yes. So we have a range of responses that participants can select. So this first question was, did you enjoy the Fit Cancer program? And these answers were overwhelmingly yes, ranging from possibly yes to definitely yes. Our next question, we asked if the staff and group provided you with a sense of community and support that you found beneficial. And the response distribution was actually identical to the previous question, with all the participants reporting some version of yes to this question. Our next questions had some more variability in the answers. So we, in terms of feeling stronger after the program, most participants felt they were stronger at the end of the program. We had one person, so that 5% equates to one participant reporting likely no and possibly no in terms of feeling stronger. Next question, do you feel you can better perform your daily activities? And in this case, again, most participants also felt they were better able to perform their daily activities at the end of the program. And we had the same thing, one person reporting likely no, one possibly no for this question. Next one, all of our participants reported that they felt confident they had the knowledge and skills to exercise safely and effectively on their own after completing Fit Cancer, which for us is huge. Again, this is really one of our primary goals of the program. So it's great to see that we were able to achieve really what we set out to do in the eyes of our participants. And finally, overwhelmingly, again, all of our participants reported they would recommend the Fit Cancer program to a fellow survivor. We also asked several questions about the use of technology during the program. We asked about, did they enjoy using Zoom? Were you satisfied with the ease of using Zoom for the program? The visual quality, sound quality of the exercise and discussion sessions. And I didn't put these up in the interest of time, but for the most part, I'd say overall, most people were really satisfied with Zoom. They had no audio issues, connection issues, so things ran pretty smoothly, again, in our participants' voices. So we also asked some questions with open-ended responses, so participants can write in whatever they would like to. So I'm going to show you guys the answers to one question, which was what were the highlights of your participation in the Fit Cancer program? And for this question, the largest majority of responses of what participants' highlights were related to the supervision and expertise from the instructors and the accountability of having a set day and time for class. So participants wrote about really enjoying the instructors and having a set class time and a program to follow was helpful for getting back into an exercise routine. So the second and third most frequent comments that came up were related to the benefits of the program for physical and mental health, as well as the group environment. Participants wrote about feeling stronger and more confident, having more energy, and that the social aspect of exercising with the group was motivating for some people. All right, so again, some summary and takeaway from all of that. So, we feel that the virtual version of Fit Cancer program was a success. We were able to expand the program outside of our local area. We were able to increase our reach to individuals who may not have such a program available to them in their area. Although these data are very preliminary, our results suggest that Fit Cancer was a positive experience for women with ovarian cancer and might help them increase their activity levels, so particularly resistance exercise, as well as improve their physical fitness outcomes like upper and lower body muscular strength. So not surprisingly, as scientists, one of our main conclusions is that there's more work to be done. I think there is a ton of potential in a virtual group-based exercise program to help women with ovarian cancer increase activity and improve their health. But to definitively determine the effectiveness of something like this, we'll definitely need a larger study, a more controlled intervention study to be able to definitively look at these outcomes. But in the meantime, in terms of the Fit Cancer program, based on the positive results and feedback that we received, we are going to continue offering the program virtually for 2021 and 2022. We're also going to continue doing more research as we're delivering the program to keep looking at the effects of the program in all of our participants, and also to continually make improvements as we go as well. So with that, I would like to thank my fantastic team in my lab at CSU, our funders, of course, and last but not least, our participants. Without all of these people and the support from our funders, none of this work would be possible. And so while we sort of move into the question sessions, I'm going to leave this slide up so that if I don't get to your question during this session and you want to contact us, so we have our phone number up there, email, you can follow us on Facebook, and if you are interested in learning more about the Fit Cancer program, we have the link here, but the easiest way is just open your Google browser and type in Fit Cancer CSU, and we should be the first hit that comes up. So thank you all very much for giving me your time to present to you, and I hope you found the presentation interesting and enjoyable, and I'm looking forward to answering some questions. Thank you very much.